Hello. Welcome, everyone. Welcome to the Normal America Show. We're just getting started here. I think this is going to be one of the best shows I've had to date. We have a really great guest today, and that is Todd Bartley. Todd's someone who's involved in the press, and he's intimately involved with sort of the press pool and the questions that are being asked to Pennsylvania Governor Wolf about his decisions to shut down part of the state and their reaction to the coronavirus and what's going on. So he's going to have a lot of access to information that would be hard for regular Americans to get. So I'm really excited to have him on the show today. So thank you so much, Todd, for being here.
Sure, Rob.
All right. We spoke a little last night, and I think our mutual friend Carlos brought us together. And one of the reasons that he brought us together is both of us, it happened to be, we're asking the same questions. You doing it in a much more relevant field because you actually have the ear of some of these people that are making these decisions. So the first thing I wanted to ask you was, can you explain the threshold question that you were asking Governor Wolf's team and why it's important to answer a question like that?
Sure, Rob. So here's what's been going on. Of course, the business closure for non-essential, then of course non-life-sustaining businesses. And where I live and where we have our business is Lycoming County. Well, Lycoming County had its first COVID-19 positive case last night. So leading up to that, over the last week, 10 days, every press conference that I've been in, whether over the internet and the virtuality that they're giving because of the social distancing, I've asked regularly about the threshold and what is the threshold that the Secretary of Health needs to get to, that the governor needs to get to, that really local officials need to get to begin to outline and issue stay-at-home and social distance orders that we're seeing are really becoming the norm in the state of Pennsylvania and across the country. And up until yesterday, that question was really never answered in any formative way. And the Secretary of Health came out and said they're really beginning to look at the metrics and the numbers that are coming in making those decisions, because what happened early in this situation, as you saw, was Governor Wolf came out and ordered the 5 contiguous counties in and around Philadelphia to basically stay at home, shelter in place, because their numbers were so high. Then, of course, Allegheny County joined that, and then he's added to that subsequently. I think we're up to 9 or 10 counties now, with Northampton being added to that today and Lehigh County being added earlier today. So up until yesterday, that threshold question really hadn't been answered publicly.
And the answer that you told me that they gave you was basically, we've met the threshold. That's what they finally said, right?
Yeah, and what's interesting is it was really a nebulous kind of answer because, well, what are the numbers? Because there are divergent numbers depending on the county. Like Erie County's officials issued a stay-at-home order for Erie County, in the northwest portion of the state, and you look at their case count, it's nowhere close to Philadelphia. It's nowhere close to Pittsburgh. But yet they're seeing something in their trends or their modeling that led them to issue that order.
Right. And that's what, for people that don't understand, if you're not familiar with Pennsylvania is very diverse. On the east and west coast, you basically have, on the west, you have Pittsburgh, and you have Erie, and then out east you have Philadelphia, and the rest is a vastly different state, us in the center, Lycoming County being one of those counties that are in the center. And so oftentimes we get overlooked where the policies are directed toward what's good for the cities, what's good for Philadelphia and Pittsburgh. And so that's why I think it's important for Wolf and the leadership of this state to be able to articulate, look, if we have individual cities saying we've met this threshold, this is why we need to have certain shutdowns, they need to explain why those shutdowns should apply to places like Lycoming County. I'm in Clarion County, another rural county, and I just don't see it. I don't see them giving the case as to why the same type of policies that work in Philly, what they're suggesting, should be applied to Lycoming.
Well, and Governor Cuomo said it today in his press conference as well. New York City is unique in its density, right? Even Los Angeles is different in its density. Chicago is different in its density. You're talking about, 3 of the top 5 cities in the United States. And Governor Cuomo said because of the density, right, we're having the issues that we have on one hand. 2, we bring in people from all over the globe, are coming through our airports, are coming through our restaurants, are coming through our city. Those are the 2 big drivers right now of why their case counts are off the chart. Now, that's the downside, if you will. The upside is their recovery rate as well, right, is skewed positively, even though their deceased numbers are skewing a little bit higher than the rest of the nation.
Mm-hmm.
Well, that's within the numbers that we're seeing as this plays out. And keep in mind, and the coronavirus task force keeps saying this, roughly, and again, these are rough numbers. The data comes in on a daily basis, moment-to-moment basis. They are changing by the moment. But currently it stands 9 out of every 10 folks that test positive for this are fully recovering.
Right.
It's that 10% window that we talked about last night that are in the at-risk situation that something really, really bad can happen out of this virus.
Right. And when we talk about the threshold, we're not necessarily just talking about the people that could potentially die, though that certainly could be a benchmark for a threshold for when you would want governments to start saying, okay, we need stay-at-home orders, we need to shut down certain businesses. But one of the things you repeatedly hear on the national level is, no, we're talking about the available amount of hospital beds and things like that. But what you just said there is really intriguing. So only 10% of the cases are considered serious. But of those 10%, what we're seeing in Pennsylvania right now, how many people are currently in hospital beds versus how many hospital beds do we have total? Because that seems to be where people want to go with the threshold. So are you seeing that we're near capacity or anything now in Pennsylvania?
So I'm so glad you asked me that question, because it came up today in the press conference with the Secretary of Health. And I believe they outlined a number currently of just north of 3,400 ICU beds, 7,193 that have tested negative, 1,127 positive as of today, and 11 deceased. That's 12,331 total cases. 12,331 total cases, negative, positive, and deceased. You follow me so far?
Yep, got you.
Out of the 1,127 positives, there are currently 120 in hospital. 38 of those cases currently, and I verified this after the press conference as well with the staff, 38 are currently in intensive care. 18 of those are currently on a ventilator. So those are the critical in ICU, right?
Yep.
So when you ask me, are we to the threshold yet? Well, there's 38 currently in ICU, and there's roughly 3,400 ICU beds.
Right.
Rob, are we to the point yet of capacity? Not at 38 out of 3,400. However, they're anticipating numbers going up, and that's what that's the unknown in this equation.
Now, and so these are the questions of it, and that's great stuff. So currently then, according to the current numbers, the most available we have, we're at 1/100th capacity, basically 34 out of basically 3,000 something ICU beds. So that's why the first two questions that I think that are important to ask is, what is the possible magnitude of the amount of people that could be infected, and what is the probability of that happening? And then we get to the threshold question. Well, at what point do you look at those numbers and say, okay, these sorts of actions are justified? So did they give any scenarios of, obviously there are unknowns, but did they give any probability of, here's the chances that we end up getting close to capacity, or are they just saying, we have no clue?
So I asked that very same question. I asked a little different way, but I asked, and it was not answered. During the press conference, they have yet to provide a written response, and they've been very good. Honestly, they have been very, very good in this crisis in at least providing some answer, right? We can judge the answer for what it is and pontificate on the answers, but they are, for better or worse, providing some type of response. And we'll get into some of the other responses they've given as well on some other topics as we progress here over time. But to the metrics I asked, and I said, and this was coming off the Governor Cuomo of New York, a press conference earlier today, he said they're working toward an apex. And he feels like the apex in New York is going to hit over the next 21 days. Well, I asked that same question. Is Pennsylvania right at what Vice President Pence just said, day 10 of 15 to get rid of the spread, right? To lower the spread of COVID-19. In Pennsylvania, where are we on that curve? Are we at day 10, 12, 15, 21? Where are we on the curve? And they didn't answer it. So my question is, they fully anticipate this exponential growth, and we saw over 200 cases again announced today. It's going to continue to climb.
Yeah, and I definitely anticipate that. I feel my fear is there are, we know that it'll climb, right? We all know that. And I feel that we don't know how much it will climb, which is the problem. And so many people, whether it be in our government or people accepting the government's response, sort of in what I consider an unquestioning manner, they're saying, well, the unknown justifies the actions. But I don't think that's the case. I think that once we get into that road, we're in some dangerous ground where we say, well, as long as we have a fear, no matter how little we know about that fear or how low the probability of that fear coming to fruition, we now have to shut down the state. And so that's my fear. So on that note, one of the things I wanted to ask you is, what are you seeing of the people you're talking to about the economic impact that the policies of Wolf are having currently, particularly in areas that aren't Philly and Pittsburgh, the economic area in middle Pennsylvania?
Brutal. Absolutely brutal.
Yeah.
The folks that are reaching out to us, and again, our client base is small business, right?
Right.
We do a lot of local sports on our other station that we share here on the News Talk station as well. It's brutal because everybody's now hunkered down. If you're not considered on the essential list, right, you've had to shutter the business.
Right.
That means people are home, and they're not getting the access to the unemployment quite yet, because those bills we'll talk about later on were just passed today by the Pennsylvania Senate.
Right.
So there's been a little bit of a lull. And as we know, Rob, right, most families are living paycheck to paycheck.
Yep.
This has done significant harm to local economies, to family budgets, to family households from an economic standpoint. Huge. Now, the other side to this is, and even though people are supposed to social distance, the churches that we interact with on a regular basis that are reaching out to the radio stations, they've opened up their doors in certain ways to provide food and food pantries, and Central Pennsylvania Food Bank has opened up again, right, in a way I don't think they ever anticipated, but they were well prepared for and ready for. It's those types of stories that we're seeing for people to meet the need.
Yeah, and that to me, as someone who's a small government advocate, I think that is the great strength of the United States, is the individual. And in times of crisis, you see heroic stories and great charity. And I think that is something, at least a silver lining, that we could see coming out of this. Now, you were talking about, there was some new stuff broke today about some of the emergency relief bills in Pennsylvania specifically. Can you talk to what some of that stuff that came out today was?
Yeah, so there were 2 Senate bills and 2 House bills, and what these did, and you heard a lot on the more of our state news than you do on the national level, of course, because we're always talking about the elections. Well, the primary is coming up the end of April. Yeah. They've now bumped the April 28th date to June 2nd. Mm-hmm. That was Senate Bill 422, and the governor was asked that today. He will sign Senate Bill 422 as soon as it hits his desk.
Okay,
they're going to have the House because he's bunkered down at the House, but he's going to sign that.
Right. And so that's one of the 4 that they passed today then?
Yes.
Okay.
And then the Senate followed up with Senate Bill 751, which updated the school code with a number of mandates on schools that, of course, can't be fulfilled under the current circumstance, right? Mm-hmm. One of the biggest things, and we can talk about this at length as we go, is the waiving the 180-day in-school requirement.
Right.
There's no way they're going to do 180 days.
Yeah.
I mean, there may be another extension beyond a week from Monday, right, that currently stands in place. We're supposed to go back April 9th.
Right.
I don't know how that stands. I don't know how that stands with the numbers in Philadelphia, unless all of a sudden the numbers in Philadelphia and Pittsburgh just drop out of the blue. There's no way Pennsylvania's going back to school the week of April 9th. And neighboring states are bumping it back to May 15th. So we can talk about that later on. House Bill 68 is the changes to the unemployment compensation law in response to COVID-19. And then House Bill 1232 gave additional funding to healthcare facilities so they can go out and get the masks and get the PPE and things that they need. And then it also allowed local municipalities to extend the state and local income tax payment and filings to later in the year. In fact, the Williamsport City Council had actually just sent a press release that they're taking that measure up in their April meeting to push those things back. So those were the 2 in the Senate, 2 in the House. Okay.
And I think, correct me if I'm wrong, because I've talked to a lot of people in the past couple of days, but I think it was me and you that were talking about, wasn't there a hospital or I think this was in Pennsylvania that basically was saying that they need emergency funding, they need more money, or that they might close up their doors. Was that me and you that were speaking of this?
It came up yesterday in the press conference. I believe it's the hospital in Easton said if they don't have $40 million in emergency funding, they were closing the doors within 2 weeks.
Right.
Now, I don't know how accurate that is. I'm not familiar with the Easton Hospital or their particular situation, but for somebody to come out with that dire of a report in the middle of this crisis was really stunning at that particular moment.
Right, and it's stunning either way. If it's true, if their books are that in trouble because of just the short-term economic measures we've already seen, that makes it troubling. Or if a situation where only a handful of deaths we've had in Pennsylvania, and they're then using the emergency to try to kind of blackmail into getting more money. Either way, it bodes really troubling for what we could see, not just in Pennsylvania, but nationwide for businesses or places like this to either exploit this situation or they're already in such trouble that they need to come out with messages like these.
I mean, we've seen in our state some world-leading healthcare systems, right?
Yep.
And you have to think that they're very well aware of what's going on in Eastern Pennsylvania and why they're not stepping in to fill that gap. I just have no idea.
It's unreal. So one of the things I looked up today, because I knew I'd be talking to you, I found the healthpa.gov website, and I wanted to look up what is the comparisons to the coronavirus to the flu. And so I got the numbers for the 2019-2020 flu season, and this starts on September 29th, 2019, and it runs until currently today. Currently today, according to the site, we've had a total of 3,153 flu-associated hospitalizations and 100 flu-associated deaths. Now, when they're talking about ICU hospital beds and critical situations, this, by the way, I looked up previous years too, so this is pretty common numbers when it comes to the flu in Pennsylvania. It just strikes me as incredibly odd that we've never seen this sort of fear-mongering or even... I'm not saying that we should say, oh, the flu is worse than COVID. That's clearly not what I'm saying. But I'm saying I was shocked that there was these many flu hospitalizations and deaths in Pennsylvania every year, basically. And the fact that we didn't even see 1/100th of the response to the flu that we're currently seeing with COVID, where we've had 11 deaths, I find that really shocking. And I think that the refusal to answer the threshold argument is largely because they will then be held accountable to this argument if things don't go as dire as they said. You jumped the gun. You took so much power for the government and freedom away from individuals, when in reality, this situation wasn't the extreme, unique situation that you painted it as.
So and I was having this conversation earlier today with a source, right? And the conversation was... it's the unknown, right? It's the fear of the unknown. Mm-hmm. So are we responding to COVID-19, or are we responding in a manner of we don't know how to respond? So this is our best effort. So, well, since we don't really know what to do, let's just shut everything down till we figure it out.
Yeah.
Does it make sense?
Yeah. And that to me, it rings true of like the Patriot Act. It rings true of what I could see the Green New Deal being, which is, with the Green New Deal, we could say, we don't know what climate change will do. Therefore, we need to do this. And to me, as someone in Pennsylvania and as a United States citizen, I worry that both our state and our national government are going to suffer tremendously because we're setting a precedent that says if all we need to do to enact these sort of policies is to have an unknown, well, that unknown could come every year. Let me ask a specific for you. In your time as a journalist, were you working as a journalist when things such as West Nile or SARS or H1N1 were about?
Yes, and I know exactly where I was on 9/11 as well. So, mm-hmm. Yeah.
And so did you see any talk of this through administrators or executive officials in the Pennsylvania governor, for example, during H1N1?
So I believe I was in a different state at the time.
Okay.
If memory serves, no, you know what? I was here during that. So if memory serves, we as a state and a response didn't even broach this.
Right.
If memory serves, we didn't even come close.
Right. That's exactly what I remember. Now I'm 35, and I wasn't necessarily politically attuned then. I think I was in college, so who knows what I was doing at that point. But that's how I remember it. I mean, just to give some comparison, you just last night got your first case of COVID in Lycoming County. Currently, right now in this flu season, there are 1,304 cases of the flu in Lycoming County. Now, even if we accept the mortality rate will be higher with COVID and the incubation period and the spread could come faster, it seems such a disproportional number, one compared to 1,300, to justify this sort of response.
For me, and again, H1N1, looking back at the timeline, was 2009, so that was early time here in Williamsport, Lycoming County. To have this kind of response, and Rob, I got to tell you, and this is what is troubling in these press conferences, the modeling and the metrics that they're seeing and that they're privy to, that you and I are not privy to, I would rather them show that to us.
Right.
And say, this is the stark reality we are looking at in the next 2, 3, 4 weeks, that this is going to be the new norm. Now, this is if we don't do anything, right? This is if we social distance, and give us those models. Why they won't, I don't understand why they won't.
Have you or other people asked to see those models?
We have actually, yeah. I've actually asked them for metrics and modeling, what modeling they're basing the decisions off of, and they'll answer a lot of questions in the press conference. They'll answer a lot of them in writing after the press conference. That's one of the ones they don't like to answer. And
do they say why they don't like to answer, or do they just ignore it completely?
They just don't. Yeah, they just don't answer.
Yeah, and that's telling to me. Now, I might be slightly more conspiratorial, but I think the reason that you don't answer those questions, the philosophical question of what is your threshold before you take these actions, and then the question of what are your models showing as far as probability and magnitude, to me, the reason they don't answer those questions is, one, so they could set a precedent to do this sort of thing in the future if they want, but secondly, so they can't be disproven. And I've heard reports that secretly, it's in the know that anybody who kind of appeals the essential working order can basically get away with it, that the governor will sign off on it. It's almost like it's more of a virtue signaling that Wolf and his administration is trying to say, keep up with the Joneses. Oh, Ohio's doing this. Oh, New York's doing this. So we have to do this as well, even if the numbers don't justify it. And so that's one of the things I find troubling. I think if they really were concerned, they would be honest with the numbers and say, look, we're convinced that our models are correct, so of course we'll give them to you. I don't really see a good reason for them to hide them.
I saw an example recently here in Williamsport, Lycoming County, of a specialty waiver that was granted, and I'm not going to get into the exact business of what it was, but let me give you some hints of what kind of business this is. It's a specialty food business, okay? And they got a waiver. Well, they're not converting what they're doing into hand sanitizer, masks, PPE, none of that. They're going back to what they were doing to begin with, which is a quote-unquote specialty food. Rob, I'm at a complete loss. I'm not trying to take away jobs from anybody or their livelihood or whatever, but I'm going, wait a minute. That to me was not taking the industrial complex to build something that's a quote-unquote need. You with me so far?
Yep, absolutely.
So you went right back to doing what you were doing as a specialty food, right? And God love you for doing it, but can you please tell me how that's a benefit when it's a specialty and arguably a seasonal situation? Because I'm not knocking their business. I'm not. But I'm asking, in the middle of a crisis and a pandemic, are we really at luxury? That's a luxury to me.
Yes.
Is it not to you?
Right. I totally agree. And this is something that perplexed me the whole time, because it's like they're having their cake and eating it too. So we've talked about this before I get to that point. One of the problems is this will become non-falsifiable. So because they won't give us the numbers of what their models said if we do nothing, and they won't give us the models of how many lives will be saved based on their policies, no matter what the number becomes at the end of the people infected or the people that pass away in Pennsylvania, Governor Wolf will say, see, my stewardship, my leadership, the policies that I issued kept those numbers from being worse than what they were. So if not one more person dies in Pennsylvania, he'll say, yes, that was because of my policies. If thousands die, he'll say, see, that justified my policies. And I think that's a huge problem.
They just asked the president in the last hour in the press briefing that he's doing on a daily basis, how many lives are going to be lost, right? How many lives are enough, right? Yep. Like, that's such a loaded question because he doesn't know. Governor Wolf doesn't know, right? Yep. They're trying to mitigate something that's never been seen before. Right? So how do you put the lives that are going to be lost in this situation on them? I got news for you. I'm the grandson, right? My late grandfather and my father, funeral directors. Okay. I'm not a funeral director. I have a knowledge of people passing away that a lot of people don't. Perspective, right? There's two certainties in life. We're going to pass away at some point, and we all got to pay taxes.
Right.
Those are the two certainties, right? So if you're going to lay at the feet of these leaders that are trying to lead in the midst of a very unique situation in our country's history, I find it really, really troubling that my fellow media members are asking those types of questions when there are many other questions that should be asked.
Right, and the way they ask it is they're clearly asking it with vitriol towards Trump. That's clearly the intent, and they're trying to set him up. They want him to say X amount of loss of life is acceptable. But I do think the threshold question's important. It just should be asked in a way that's not that callous. But I do think that there's a question to be had of, at what point do you say the cure is worse than the virus, or that the loss of lives or the loss of livelihood would outweigh? What are the amount? What is your model that you're kind of looking at to get that question? So I get that, but yeah, saying like, did you see Governor Cuomo said yesterday, I'm not going to sacrifice my mother for a 401k, in reference to Trump saying we'd like to get the economy open by Easter. I mean, that sort of thing from people, to me, it's just unfair.
We agree. Yeah. I mean, it's really tough sometimes for me to be on these calls, in these press conferences, and getting some really significant information from cabinet holders and stakeholders and our leaders, and then have some of the questions that are being thrown around from other media members that I would argue are a waste of time, right? So I really appreciated today when Dr. Levine opened the press conference and gave the numbers of the beds, the ventilators. Right. I thought that was spot on her part today to do that at the outset, because there were 15 questions yesterday about beds and ventilators.
Yep.
So now that we know, right, all you new people that dial in tomorrow, take notes from today, because it's all recorded. It's already out there. Go do your homework tonight, because it's beyond frustrating. They're now only giving us roughly 30 minutes a day in these press conferences. Let's get the real questions and drill down on what's really going on.
Right. Yeah, and real quick, we'll get to the press here in a second too. What I was going to say real quick about having their cake and eating it too. The dirty little secret is there's two arguments going on at the same time. There is the justification for sort of the shutdown we see in Pennsylvania, but then there's the fact that a lot of people aren't really following the advice. And so you see this, you see people, and I think correctly, you see at the national level, people like Trump or people like Dr. Fauci coming out saying, look, please listen to these standards that we're putting out. And it's a shame people aren't. And I think you also see it at the state level. Now, I think a lot of this has to do with the cry wolf scenario we've seen, where a lot of people have been told it's the end of the world so many times that now they think, oh, this must just be like everything else. And it's not. So I think that there's a lot of blame to go in government and media that have set that precedent. But the point I want to make is, how can we then fairly assess if there's this order in place, but exemptions are given for businesses that really doesn't seem like they should have got these exemptions, and people are kind of not listening? So how do we know when with the end result, when all the smoke and the dust settles, how effective was these policies, and does it justify these sort of policies in the future to respond to unknown situations like this?
So let me answer your question with the beginning of a question. Rob, what's to stop a business owner from boarding up the front of the business, the forward-facing side of the business, if they're in a quote-unquote light manufacturing or manufacturing or making of a product, right?
Yep.
They board up the windows in the front. they still have a key to the back door that's a steel door, no window, right?
Yep.
To stop them from locking themselves in their business, continuing to do their product, and then in the dark of night, they're putting it in the delivery van and taking it wherever it needs to go. Are they in violation of the order, being a quote-unquote non-licensed business? And are their neighbors going to be calling the police to go, you're in violation?
Right? That's exactly the question. And then because at some level things like that are going, I can't say that I definitively know that that's happening. I don't know anything personally, but at some level that's happening. At some level, individuals are still going to a friend's house and having parties in ways that's recommended against and things like that. So I don't know how we'll be able to trust that the solution worked. They'll say, because let me ask this question. Have anybody in Wolf's administration spoke to how they see evidence that their protective measures and what they've done is having some sort of beneficial effect?
So we've kind of danced around that question a little bit, and what we get a lot of the answer is we're trying to mitigate, right? So they're trying to put out the fire that's burning right now. So they're trying to throw as much water on the fire as they can, right? The problem is new flames keep popping up.
Right.
In different places. So we got to put this fire out over in this county. We got to put the fire out over in this county. Oh, we've got a case now in Lycoming County. What's going to happen there with their numbers, right? So that's the mitigation is something they use a lot. So now you've seen that the $40 million has been moved over today. That was when in one of the bills that we talked about a little bit earlier. They're starting to fund what's going on. Here's the issue, and Governor Cuomo hit it spot on. He said out of the first $2 trillion of stimulus that's coming, New York State government's getting, what was it, $3.4 billion, and New York City's getting $1.3 billion.
Yep.
He goes, that's a drop. He said, we're $9-10 billion in the hole right now today.
Yep.
What's $4 billion going to do? What's $5 billion going to do? Right? So there's going to be a shortfall.
Right. And I understand that. And I could, any solution to a problem, particularly of this magnitude, is going to take time before you see results. But again, if you don't give the initial models of what you're looking at, how many people could be affected, then it's really hard to determine how effective your response was. And there's just something that it just makes me scratch my head that people are willing to unquestionably accept this because, again, we're setting ourselves up for a situation where we as people in this country clamor for, oh, there's an unknown fear. And last time we were willing to give up these rights and willing to harm the economy significantly based on an unknown fear. So why not this time? And it would be nice to, I know it's not the highest priority now, but it would be nice to have some effective measure of how effective was the solution, because we're going to know what the cost of the solution is. That's what our economic future is going to be going forward, but we're not going to know. We'll never know how effective it was.
So I've got a mitigating suggestion. There are any number of tour buses that come through Williamsport off I-80, 180, and 15 on a nearly daily basis. Mm-hmm. They stop at our establishments and get a bite to eat and this type of deal. And a lot of them, if not the great majority of them, are coming from New York City, which, tell me if I'm wrong, Rob, they're leading the country right now in cases of COVID-19, right?
Yep, absolutely.
You want to mitigate spread real quick? Shut those down today.
Well, and that's...
Sorry. Our local businesses, I'm sorry, but can we take a pause on that for at least 2 weeks? Because if those same people that are touring on those buses go to Florida, Florida's governor just said the moment you get off that bus in Florida or off that plane, you're in self-isolation and quarantine for 2 weeks.
Right, and I totally agree with that. Now, look, I, as someone who's a fan of small government, and I've been very critical of giving the government a blank check or giving them license to infringe on any rights based on the assumption there's an unknown, so they have to do whatever. I've been very critical of that. But I've also said that if they're explaining things and they're talking about what the limits will be and things that I'm not seeing at either the state or the federal level, then I could be convinced that, yes, potentially this is the right policy. So along with that goes a sort of triage system. And it's something you've seen Trump talk about in the past couple of days where he says, maybe we'll open up parts of the country. Maybe we'll open up, the farming belt. And I think that that's something that when I was talking to you, that's something that I found really intriguing was I don't see Wolf necessarily having that same mentality where it's like, look, perhaps in certain situations, like you just said with these buses, we limit that. We limit situations in Philadelphia and in Pittsburgh. But in places like Lycoming County, Clarion County, we still have some kind of proactive measures, but we lighten up a little because we think that the harm that's being caused there economically is going to outweigh our new model of the actual impact that Corona could have there.
So I have another question for a question, Rob.
Sure.
Let's run this forward just a little bit. And let's say we begin to open up central Pennsylvania. We reopen businesses. Well, are you going to reopen schools? Because here's the kicker to reopening schools. How can you go back to school in Lycoming County and Williamsport, Pennsylvania, right, and not go back to school in Philadelphia, which is a hot zone, or Erie, which apparently now has a stay-at-home order, or Allegheny County, and have any kind of equity in the education system when you're asking the federal government for waivers of what you're asking them for?
It's incredibly tough. Here's another question I have, right? This is kind of more of a philosophical question about higher education. We're told that in order to get a 4-year degree, that means something. You had to go through certain, it's the same with high school as well, but in universities particularly, it means something. It means that you've checked these boxes and now you're competent for whatever your degree stands for. So I know several people that this was their last semester at university, at state universities, and they were involved in internships for very specific majors that had to do with the healthcare field. So they've just shut down. What do? Do you just give them the degree, even though they didn't pass the most important capstone of what it means to be in that degree? Do you push them back, which means you would have to refund their money, or that you allow them to come another semester? Like, it's very difficult. Once you start, and it just goes to show these are little issues in the context of I lost my livelihood or I got the coronavirus, but it goes to show the complexity and the seriousness once the government starts to shut things down of the trickle-down effect it has in all areas of life.
So Department of Health, and I believe partnered with Department of Human Services, and I'll stand corrected on that. There's a story about it on talkwaynessport.com. They put out guidance earlier this week or end of last week on relaxing the standards, right, for a time, because if you're in that particular situation, to get you into the workforce because they feel there's going to be a need and a strain on the system, you're already basically there, right? You're in that internship, you're in that practicum, you're into your clinical hours, you're doing those types of things. They wanted to suspend, if you will, being a registered clinician and give you that certification. And my sense of it is that they're going to go back and finish off with continuing education hours, but give them the certification to get them into the workforce early. And honestly, Rob, you and I both know from life experience, there's no better teacher than life, right?
That's right.
Get in, you're dealing with the pandemic, not that you're inexperienced with it, but you've got the PPE, you got great people around you that are going to teach you, that have seen these cases, and you're going to learn so early in your career how to deal with this. Again, I'm not trying to make light of a pandemic.
Right.
Please don't misunderstand. But if this generation gets in there now, you're talking carrying that forward for 2-3 more generations.
I agree. And look, again, I'm not making light of the situation either, but it is, I mean, in times like this, it's nice to have some silver linings or some positives that could come out of it. I saw Mike Rowe from Dirty Jobs. He was on Tucker Carlson last night, and he was talking about how one of the silver linings to this could be bringing back the manufacturing sector, bringing back trade schools, the understanding that working with your hands is still important in the United States. On the same token, I think that one of the things we could see is, I think we'll start to see perhaps a reduction in the cost of higher education as people learn, look, you don't have to be on physical site all this time. You maybe don't need all of the hours in this superfluous stuff that we said you did in order to have a rounded education to be a specialized medical professional or something like that. Because I'm betting you're absolutely right. The people that get thrust into the workforce without having their capstone or finishing this stuff, they're going to end up for generations being very effective medical professionals. And so that's something that I'm hoping. I'm hoping that we could have some sort of silver lining like this to come out of that.
I mean, think about this: putting on your resume, your portfolio. Oh, by the way, what did you do your first year in the medical field? Yeah. Oh, I dealt with COVID-19.
Right.
I mean, you talk about right out of school, that's what you dealt with.
Mm-hmm. Yeah, absolutely. Now, let me ask you a question about the media in particular. So, on the national level, I'm someone who's hugely critical of our media at the mainstream, like national level. I can't say to know as much of what's going on the state level. But on the national level, there's kind of been this narrative out there, which I agree with, that they're antagonistic to Trump to the point of detriment to the country. One of the things I think that they've done that is incredibly appalling to me that I wanted to get your opinion as a journalist on was this story with the individuals that took fish tank cleaner because it had a medication that Trump said could possibly be a medication that would be effective in the future. And they seem to run this story knowing that this wasn't a prescribed medication. This was something people took over the counter in the form of a cleaner that wasn't even just the medication. I think that them knowingly doing that causes so much damage to the country now, not just in the idea of dividing us, but also quite literally, because there are people out there that will hear that story and say, well, we can't trust anything Trump says. And then they're not going to listen to the guidelines that people like Dr. Fauci are putting out there that actually have a decent chance of stopping the spread of this virus. So as a journalist, how does it make you feel to see activist journalists like this that are actually, in my opinion, endangering people by spreading a smear like that?
So one of the things that struck me out of yesterday's press conference, and it was the 6 o'clock press conference after President Trump and part of the team had already done the 2-hour virtual town hall that we carry here on Newstalk 104.1, right? So he'd had his fill of the media, right? So he's going on 2.5, going on 3 hours of media in the middle of a pandemic, right? And at the end of his comment, and then he left the team to answer some more questions in the evening press briefing, one of the reporters is shouting at him going, it only takes one person to infect a county.
Yeah.
I thought that was so rude. First of all, I mean, he is the leader of the free world, right? So at least have some respect.
Yep.
But to your point, they are antagonistic toward this president. I mean, I can't even imagine. They ask him on a daily basis, did you get tested? Vice president's been tested, right? Vice president's wife's been tested. They've got somebody on vice president's staff who's in quarantine.
Mm-hmm.
I hate to say this, the reaction of the national media, if our president tested positive for COVID-19, we've never seen anything like it, ever.
Yep. It'd be elation. That's how they would feel. I mean, it's so disturbing. And I'm not trying to put words in your mouth, but you would consider yourself a conservative person, right? So you're not exactly in the bag for Tom Wolf, or someone that's really cheering for the policies of Tom Wolf, who's, again, the Pennsylvania governor. But just from the small time I've known you and talked to you, you would never consider to have that sort of reaction and try to make political points in a pandemic while you're being allowed to ask questions to try to educate people as what's going on. Would you ever in a million years consider behaving like that?
Never. No. And I'll tell you, I have voted for both sides of the aisle. Mm-hmm. As an adult. We've lived in Ohio. We've lived all over the country, right? So I voted for both sides of the aisle. Give you a perfect example. When we lived in Ohio, at the time, we voted for then Ted Strickland, who was running for a congressional seat. He was a Democrat. He ended up being the governor of the state of Ohio as a Democrat.
Yep.
So I have voted arguably right on the other side of the aisle. My issue has always been, as a journalist, I have to take the politics out of it,
right,
and try to get to the common sense and some semblance of truth, right? And this whole situation and try to get some real numbers and some facts behind it. And it is so troubling right now. I give an example. I asked for numbers today of total cases recovered. It was asked in the New York press conference, how many cases recovered? They couldn't readily give that number, but they said they would provide it. Well, now what's happening is the hospitals and health systems are not readily providing that number to the Department of Health. So what I've asked for from them is, if you could begin to process those numbers, that would be great.
Right. Absolutely. Here's another question I was thinking of that I don't know if you've asked or if you've got an answer to. When they talk about the people that are hospitalized or that require hospitalization, is there an average length of time for the cases that end up recovering that they require hospitalization?
So I asked that today, and they're putting that number together as we speak. Okay. It's probably going to take about another week or so, because these cases are so new. And what Dr. Levine references is the early March date, right? So we're 3 weeks into this from their data collection standpoint. I would say, just from a grace standpoint, and let's say being a professional in this whole deal, let's give them an extra week to put that together.
Yeah, and I agree. I think that it's important. I'm glad that you're there asking questions like that, because that, to me, look, maybe I'm old school in this sense, but to me, I have more of a fear of the unknown than I would of the known. Now, I know that sounds hypocritical to what I'm saying is don't give the government a blank check to fight the unknown. But I think that that's primarily true. I think that if Wolf or Trump would tell Americans, like, look, let me try to give you the models, let me try to give you the numbers as best as we know, no matter how bad those might seem, I think that that would cause less fear and panic than sort of what I consider to be a mixed message, where part of the message is, oh, it's not that bad, symptoms are similar to the flu, don't worry about it, but then, oh, we have to endorse lockdowns and things like that. And so getting these specific answers, I think that allows the layperson like me to say, oh, okay, I could differentiate this from the flu, because if they're able to tell me, look, the serious hospitalizations require 20 days, but I look at the flu and a hospitalization under the flu only requires 2 days, now I'm like, okay, this makes sense why they're worried about capacity, because right now, just looking at the numbers, it doesn't add up as a layperson.
We agree.
And I think, let me ask you this, and the people you're talking to, and I know I have a good idea, I know what the answer is going to be, because I've been talking to a lot of people. Do you think in Pennsylvania right now, from the people you talk to, that there's more fear of the virus or the government reaction to the virus?
The government reaction, or as a lot of people are putting it, that I speak to regularly, is the overreaction of the government. I get it if you want to do this for a week to 2 weeks. We drag this into a third, a fourth, a fifth week. I go back to what we talked about earlier in the first half hour, is the economic impact and distress that's going to cause. I don't think anybody ever planned that far ahead.
Right. I agree. I agree 100%. And I think one of the things that disturbs me, and again, look, places like Twitter that I'm on, or places like YouTube, I understand it's a bubble. But in the national media, you see this as well, where there's just this kind of virtue signaling shaming of anyone who wants to talk about the economic impact. And somehow that makes you callous. That means that, oh, you don't care that if elderly people die. In my case, I can only speak for myself. It couldn't be further from the truth. But I don't think, just the way people talk, I don't think they quite understand what it's like to live paycheck to paycheck. And most Pennsylvanians are in that position. And just how incredibly fearful and incredibly damaging it is, not just to you economically, but to your mental health, to your relationships with your family, also to your physical health, to be that nervous and that upset about potentially not being able to pay bills and lose your livelihood.
Rob, let me go back to what I referenced earlier about my family with my father and my late grandfather being funeral directors. I cannot tell you how many days or nights that my dad would come home and just is emotionally, physically spent, because he has just spent time with family members who have lost a loved one, right? So I'm not being discompassionate in this of there is going to be a loss of life to COVID-19. I'm not being discompassionate to that. And you're spot on with the mental health side of it and the stress levels and the toll it's going to take. I must tell you, however, we can't fall prey to the fact that people are going to lose their lives in the COVID-19 pandemic, because, again, death is a certainty in our lives. There's two variables, when and how, right? And we have to deal with these situations in reality. We can't go back to 30,000 feet and go, well, what if, when you're not showing the general public why.
Right.
You're showing us no metrics. You're showing us no models. Why did you close my family business that's been open for 50, 75, 100 years? Governor, Secretary of Health, we need to know why.
Yes. And that's been my stance the entire time. And maybe it's something that I need to make clear, but I'm not, in the case of Pennsylvania, I'm not saying I know for a fact that Wolf overreacted. I don't know that. I have no clue. I don't know the models he's looking at because they won't tell us. I don't know what their threshold was for when they need to take these actions because they won't tell us. And that's, to me, the big problem. If they told us, you could, look, leaders are fallible. You would never expect, you hope that who you elect as a leader will come through in the clutch in the most trying of times, like something like this. But certainly they're fallible, and that's forgivable at the end of the day. So if mistakes are made, okay, we could address those later. But what I just consider unforgivable is not telling us the why in the first place. I mean, if it's fear of, well, I'm afraid if I come out and I give this model and then that model was incorrect, then I'll be judged harshly for it. That's less important right now than actually explaining to Pennsylvanians who are losing their livelihood, and they're looking and they're saying 11 people dead. Pennsylvanians in Lycoming County that say one person diagnosed, and I'm going to lose my livelihood. And when we don't have that, well, listen, here's exactly what the models are. This is what justifies this fear. People are getting really, really upset, and I feel this is damage that could have been, a lot of this damage of people being upset and people not trusting could have been alleviated by just telling us the why in the first place.
And now you have a disconnect between the national messaging, the state messaging, and the local messaging, because the president is saying, I'd like to have the country reopened by Easter. You had somebody earlier today and Dr. Levine say, we're looking at a month
right
of cases. How many numbers are you looking at, Dr. Levine? Are you looking at a peak in a week? Are you looking at a peak in 3 weeks, a month? What are you looking at? So I asked a follow-up and said, okay, you let it out. You said a month. Where are we? Is a month today? Is it a week? Where are we?
Right.
No response. So I'm going to re-ask it again tomorrow when they come out with more numbers, right? And we're just going to keep asking and asking and asking so everybody can get informed.
Right. That's the best we could do. And I'm absolutely thankful that you're there, because I think at least I'm not there at the state level. What I can see at the national level is 90% of the questions that are asked are irrelevant. And as much as I may have criticized Trump for some of his behavior, you have to tip your cap for the fact that he's out there every day spending hours discussing this. Like, he's not hiding from it. He's out there talking about it. And so you would like to have journalists, like, for me, this won't be applicable to the state level, but, for goodness sakes, there was a Politico article that actually had quotes from Trump's DOJ requesting the suspension of habeas corpus. How is no one in the national media asked about that story? I mean, that's unforgivable from a media stance to me.
Because they don't care at that level. It's all about, what I'm watching on a daily basis, it's all about we have to remove from office in an election year, right?
Right.
And what they fail to understand, and this is what I don't understand, okay? Rob, he's a duly elected president, right? What they don't understand is if he goes, guess who's in charge next?
Yeah, I know.
Like Pence.
Yep.
Right? There's an order of succession in how we do this. Yeah. So long story short, one of the things that really bothers me currently is in the hyper media cycle. I'll give you an example. Last night, I broke about the first COVID case in Lycoming County. I had it directly from the coroner.
Yep.
And it was a case. He interacts with the health department on a daily basis, right? Obviously, he would have knowledge of that case. Everybody goes, wait a minute. If it's coming from the coroner, it had to be somebody that's deceased. Not necessarily.
Right.
He's working hand in glove with the health department.
Right.
So, of course, he had the knowledge of that. So we confirmed it with him by phone last night, put it out, and the next thing you know, our local hammer and chisel outlet decides to wait till this morning to put it out with no attribution. Another site put it out 2 hours after that, again, no attribution.
Yep.
So you're welcome, guys, for breaking the biggest story of the year.
Yep.
And thanks for nothing, for not attributing it, because we do good journalism here. We do ask the questions that need to be asked. And I got news for you. Those same people that use the hammer and chisel and do other things are not on those calls with the governor, with the health department, with the with the ag secretary, with human services. They're not there. They're absent. So stop telling everybody how you're relevant, because that ship sailed a long time ago.
Oh, that's right. They're not journalists. They're pundits. That's what they are. They're activists who wear the mantle of journalism, but they don't actually engage in journalism. They wait for other people to do the work, and then they comment on the work. They're basically doing what I'm doing, except I would never have the nerve to call myself a journalist. And it infuriates me, because when you watch these, I say this all the time on my channel, I say, you watch these people pat themselves on the back. Well, they'll have, what's the National Press Dinner, and they give themselves awards and talk, democracy dies in darkness, and the importance of journalism holding truth to power, and being the last bastion to inform the people. They're right. That is how important journalism is. It's a shame we're in such short supply of real journalists. It boggles my mind.
Give an example. There was a county government press conference about a week ago. Carried it live here on the radio on Talk 104.1, streamed it on TalkWilliamsport.com. We had any number of media members, right, from Northeast and Central Pennsylvania in the room. you had elected officials, the president judge, the current district attorney, the prison warden, the EOC director, Emergency Operations Center director, public safety director, head of administration. You had all these people in this room. Guess who asked all 4 questions, Rob?
Yep.
Me.
Yep.
Well, are you just going to take what they tell you? And these are people we live side by side with, worship with on any days of the week, right? We're in schools together with them and our kids together, right? I get it. We're all part of the same community. That doesn't mean you don't ask questions of them.
Right. I absolutely agree. And I think that, it's in short supply. We'll wrap up here, but I just want to say thank you so much, because I'm asking, what you're saying there is what I'm saying as a non-journalist. I'm sitting here screaming in a microphone to people. I would like, I'm a guy who, on the weekends was streaming sometimes, playing video games with my wife or playing trivia games with my wife and stuff like that. Why does it fall on someone like me to ask what I consider basic questions when we have people winning journalism awards in the national media that have a chance to sit there in front of Dr. Fauci, in front of Trump, in front of Pence, and they're not asking any of these questions? And so I fault both the government for waiting to be asked before they answer these questions about their models and things like that. But I also fault the media, who's not out there really trying to ask these questions. And so when Carlos put me in touch with you and was like, hey, Rob, I've heard you screaming about no one asking these questions for a week and a half. Here's someone asking them. I jumped at the chance to talk to you, because I'm really thankful that we have someone like you out there trying to ask questions in difficult times like this so people could be more informed.
Give an example. I know you got to go and we got to wrap up, but I got to tell you, being at the swearing in of Representative Keller right outside the door of Speaker Pelosi's office when they did the ceremony, right, for the photo and the video and the cameras and everything else, and then watching on the floor of the House, right, watching him do that and being there in person and being able to get, his office on the phone today. To react to the stimulus. You're not getting that from other media members.
Right.
To be able to get the state senator on the phone in his office on the phone and say, what did you guys just do today on the floor of the Senate in Harrisburg? And again, they did it remotely because they're doing the whole social distancing thing. Right. So people are here, there, and everywhere. They're doing that remotely. Now, here's my thing to go off on, Rob. They're going crazy at the national level, Senate and House, that they can't do the stuff remotely. Guess what? You want to use an example of remote voting and getting stuff done? How about going to the Commonwealth and the PA Senate and the PA House? Because they just did it today very effectively.
I ran against Fred Keller in that special election in District 12 there, and one of the things that I talked about was I feel that at the national level, what happens with politics is people are well-intended and they go to D.C. and they want to represent their constituents, but you spend so much time in that bubble that's D.C., you kind of forget what it's like back home, and you're listening to CNN every night or the Twitterati every night or whatever, and you forget what are the voices like back home. So I recommended in the special election in 2019, before any of this crazy stuff, that we should push for legislation at the national level that would allow for remote voting and things like that, except in special occasions. Maybe you'd be in DC one day a week or something like that for things that, would require physical votes. But other than that, these remote votings, I think, would be a good idea. That's another possible silver lining where we could see Congress people being able to spend more time with their constituents, to be able to work more fluently because they're able to spend time at home, and therefore kind of be a better voice for people I think desperately need it, like those in central Pennsylvania.
There was one question that I saw pop up as we were talking about the underlying stats of the conditions of folks. And this came up in the stats that are coming to us from Italy, because Italy's used a lot in the governor's press conferences.
Yes.
My understanding is the way Italy is counting cases is that if you've contracted, regardless of the underlying condition you may have been in hospital for, if you pass away and you contracted COVID-19, you're passing away from COVID-19.
Yes, and
so
I wanted
just heart failure, diabetes.
I wanted to ask you, when they're talking about people in serious condition or those that have passed away in Pennsylvania, are they being specific to say they just had COVID or COVID was the direct cause of their serious condition? Or is there a chance something similar could be happening here where it's some sort of mixture that actually they had, other symptoms from other illnesses? I hadn't been able to research anything on that.
So as we drill down on these numbers going forward, and again, it's so fluid, it's changing every day, and the protocols are changing on how to report and where they're getting it from. And again, they'll even tell you that the test numbers are from here, but not here, right? From the private lab or the hospitals, all kind of deal. So what they're doing now is they're creating the model as we go to how to report it. And I'm sure there are other media outlets that are doing this as well, but I'm providing, some input to them of going, hey, listen, I come from like a medical background family type situation. So this is what I'm being asked and really what I would like to see to be able to share it with people without violating patients' rights or HIPAA or anything like that. Just generally speaking. And then what I really like to see is the demographics. Right. And they talked about doing age today. That's going to be within a week. And then the demographics of it. Okay, where are they coming from? Socioeconomic background. And so we can begin to see, are there common denominators in who is contracting, who's recovering, and unfortunately, who's passing away? Are there common threads in that? And again, listen, they're in a lot higher conversations that you and I are having right now with people that are above them as well. Right. That we'd like to see that rolled out nationally. But again, if we can get it at our local and state level, that'd be great. And again, like you said earlier, you're dealing with a case out there, a case here. When you're to this few, thankfully, number of cases, that's great for our communities, really. And they actually addressed this the other day, and I asked it. I said, what happens if our area has the capacity and Philadelphia or Pittsburgh gets overwhelmed? Are you sending them our way? We'd prefer not to, but if you've got capacity, guess what? They're coming your way.
Right. Right, yeah, and that's a great question, too, and you're absolutely right to ask it. So, all right, everyone, that's Todd Bartley. You can find him on talkwilliamsport.com. Is there any place else they could find you that you'd want to reach, or is that the best place to read the articles you're writing?
That's really the best place, and what we did last week is, speaking of the national media, we added basically every Sunday show to our Sunday lineup, so like Meet the Press, 60 Minutes, Face the Nation, Sunday with Fox News Sunday with Chris Wallace. We've got that whole lineup, and we got a national lineup of folks that are doing roundtables all the time. I mean, it's just, if you want to know what's going on, we've got Radio PA, we've got local news updates going 24/7. When we do the press conferences, we're carrying Dr. Levine, the governor, and the president almost on a daily basis. We had a DCED press conference the other day. We took that. Department of Agriculture. It's all posted to the website. If you go into those stories, there's audio of those press conferences. You can go get a lot of YouTube links in there to go watch that stuff. Folks, here's what I can tell you. We've got all this time to stay at home, right? Because a lot of folks are not working. Right. Rob, I got to tell you, get informed on this deal. Learn as much as you can about COVID. And I'm going to stay at home, right? For my wife the other night. She was talking to somebody on the phone, and they said, well, how's Todd doing? And she said, oh, he's great. It's COVID all the time, 24/7. Because I want to know.
Right. That's exactly. I've had similar conversations with my wife. Yeah, absolutely. And that's one of the things about, not to sound too cheesy or something like that, but one of the things about America is what has made us great is how we react to trying situations. And one of the things that I talk about all the time is America is the greatest country in the history of the world because it focused on personal freedom and personal responsibility. And so we should be asking ourselves, what can we do to make this situation better now? And what can we do going forward to make sure that situations like this don't arise again? And to me, one of the big fears is government overreach. So what we could do, a tangible thing you could do, in addition to helping your neighbors and helping out with things associated with the virus and preparing for yourself, but you could learn, you could educate yourself, you could learn to be critical, but not necessarily be adversarial to the people that are making these decisions and trying to get as many answers as you can. Because if we become a more educated mass and more educated citizenry, there's a better chance that will force our government to be more prepared the next time something like this happens.
I have been able, fortunately, for our listening audience here in Williamsport, Lycoming County, fortunately, I've been able to glean some very amazing information from our state leaders, our federal leaders, our local leaders here recently in the last 2 weeks. it's been a learning curve for me as well, but for everybody that's been listening online and listening to the radio stations here in Williamsport and Lycoming County, I think we're all better served for it because, like I said, a lot of the other media members in here locally are not doing anything at that level. Nothing.
Yep, I totally agree. So thank you so much for being here. Again, everyone who's listening, whether you're listening live now or listening in the future, please check out Todd Bartley at TalkWilliamsport.com. I think you're one of the best journalists I've talked to, and I really thank you for this. Even if you're not in Pennsylvania, it's important. The answers that we're getting out of Pennsylvania and the specific situation that's occurring in Pennsylvania is analogous to many other states and the federal level. So these sorts of questions that you're asking, Todd, I think that that's a good model for the questions we could be answering elsewhere. So thank you so much for everything you're doing, and thanks for being a guest tonight.
Appreciate it, Rob. Thanks.
All right, we'll talk to you all soon. I'll be on Sarah Corrier's show. That's going to be at 10 p.m. tonight. There's a link in the description, and I put a link in the chat there to YouTube, to TalkWilliamsport.com. I'll make sure that I'm adding that to the description of this video afterwards as well. So thank you so much, everyone. Stay safe out there, and as always, have a good one.